Imagine navigating a massive, sterile bureaucracy completely alone. Every door leads to another waiting room, and every form asks you to explain your trauma to a system that doesn't seem to recognize you exist. That isolation takes a severe emotional toll. This chart shows the completion rates for the NHS Talking Therapies programme. While nearly 80% of white patients finish their prescribed course of treatment, the success rate for black patients sits at just 3.8%. This disparity creates what researchers call a data void. Because they fall out of the standard care pathways, black queer men become statistically invisible to the healthcare infrastructure, remaining unseen until they experience a severe or costly medical crisis. The current system is operating exactly as it was built to function. It is an analog, sickness-based loop designed for a completely different demographic. The UK has a relatively newly elected government, and for the first time in 40 years, they are updating the Mental Health Act. A major part of this update is Lord Darcy's 10-year plan, which explicitly mandates a shift in healthcare from large, static hospitals to local communities, moving the focus from treating sickness to preventing it. The policy mandate is clear. However, the institutions tasked with executing it lack the data, the community relationships, or the trust required to actually engineer this shift for all marginalized groups. Human behaviors can spread through populations similarly to viruses, but they do not all follow the same biological or social rules. Sociologist Damon Santola calls the spread of easy things, like a viral meme or a piece of breaking news, a simple contagion. These transmit rapidly across long, weak ties between distant acquaintances. More difficult behavioral changes, like seeking mental health care or unlearning trauma, operate as complex contagions. They do not spread through a single point of contact. They require dense, clustered groupings, interconnected by wide social bridges. Complex contagion requires social reinforcement. An individual must see multiple trusted peers adopt a new behaviour before they deem it safe or credible enough to do so themselves. Traditional NHS therapy waitlists fail because they isolate the individual from this reinforcement. True behavioural transformation requires saturating a peer network. BLKOUT's Critical Frequency Initiative applies this precise network science. It is a 5-year, £10.5 million investment designed to target 35,000 lives. Instead of waiting for patients to walk into clinics or fill in a form, they map the specific small world networks of black queer men to identify those tight social clusters that already exist. They seed these clusters with targeted tools, deploying active peer support. A 24/7 AI companion named Ivor, and a podcast called The Relay to inject new behavioural norms directly into the network. Damon Santola's research shows that a new norm only needs to reach a 25% tipping point to take hold. Within this specific community of 35,000, that requires roughly 45,000 exposure points to trigger a cascade. Once that threshold is crossed, individual healing ceases to be an isolated medical event. It snowballs into an unstoppable community-wide cultural norm. Marginalized groups have historically been forced to protest simply to survive hostile environments. Today, they are leveraging their networks to build institutional power. Community power has evolved from street-level resistance into demanding structural policy change and actual legislative accountability. BLKOUT operates as a community benefit society, a democratic mutual, owned by its members. This structure executes a direct transfer of resources to the people harmed by systemic failure, bypassing the limitations of one-off project-based funding. This model creates capacity for those at the absolute margins of society to engage in challenge and ultimately redesign the centre of the healthcare system. Solving a systemic health crisis requires looking past the individual patient to the peer networks that sustain them. When 25% of a community gains the power to heal themselves and each other, they move from being passive recipients of care to being the architects of their own future. This self-determination is the definition of liberation. And for this community, that liberation is only possible because they're stronger together.